All right, folks, I'm gonna talk to you about 5 facial rejuvenation mistakes that are gonna cost you lots of time, lots of money, and even your appearance. So you do not wanna miss this video. Hi everyone, I'm Dr. Amir Karim, board certified facial plastic surgeon and founder and creator of Karim MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're gonna talk about common mistakes made by people over 50 when it comes to facial rejuvenation. This is something I'm especially passionate about, and really at the end of the day, it's why I have this channel in addition to my other social media channel on Instagram, etc. because there's only so many people I can physically touch their lives of, surgically speaking. Between 24 and 30 patients a month is all I can operate on. But there's so many more people that I can help, advise, and guide who will never have surgery with me, I'll never have the privilege to meeting them. And chances are the overwhelming majority of you are in that category. But you can take this information that I'm about to share with you, save yourself a lot of time, money, heartache, risk, potential complications, and give yourself an opportunity to set a very clear path going forward and not to get sidetracked into a bunch of BS that will eventually make you feel foolish, make you feel taken, make you feel regretful. And if you're, like all the other patients that I've seen over the years, make you feel like you've lost a lot of time and a lot of money in the process, and ultimately have not reached the goal which set you on this path in the first place, which is to ultimately defy aging and look as young as you feel. What's challenging in this entire process, and what the premise of this video is for, is the aging process is real, the changes are real, happens to every single person. The types of tools, the options, the treatment opportunities are nearly endless. And you as a consumer are sitting there wondering, what do I do? What do I apply? Is it Botox? Is it filler? Is it laser? Is it this? Is it that? Is it surgery? What do I need to do? And depending on who you talk to, depending on which office you walk into, depending on which friend you ask, depending on which Instagram channel you follow, you're gonna get a different opinion. I'm gonna tell you this with a lot of confidence. And I'm gonna tell you this with the willingness to take on any backlash from any other provider that wants to challenge me in this. There's literally only one way forward. And I'm gonna share what that one way forward is. And at the end of it, you're gonna decide for yourself if that makes sense, and you're gonna decide for yourself what is the right path forward for you. And you can challenge it, you can send it to your doctor, you can send it to your dermatologist, you can send it to your injector, you can send it to whoever you want, and let them, chime in and offer any challenge toward this philosophy or this approach as you want. And remember, we're talking specifically of people, men or women, but specifically women over the age of 50. All right, so let's get into it. I want to preface everything I'm about to say and why we're even talking about 50 as an important divide. Yes, aging is a continuum. You can imagine it's starting from basically the day we're born, right? But that doesn't matter. That's like pointless to say that, because when you're a teenager, when you're 20, when you're 30, and even when you're in your early 40s, fundamentally, you look the same. No one would ever not recognize you from where you were when you're in your early 20s to where you are in your late 30s and early 40s, right? No one will question it. Now, it's kind of sad, but it's true. It's like you look at somebody's photograph when they're in their 30s, and then you look at them when they're in their 60s, you have a very hard time connecting these two people as the same person. I mean, the change is very, very real. Why does that happen? Well, because even though it starts in our 20s, there's a gradual shift in estrogen that happens. The shift in estrogen correlates very directly with the shift in collagen. So collagen loss diminishes as estrogen begins to diminish, and as a result, there's a gradual worsening of the skin condition, fine lines, wrinkles, thinning, discoloration, etc., all these things that happen. But something happens right at the end of our 40s and the beginning of the 50s. And what is that? It's perimenopause and menopause. That's where the hormonal shifts happen. It's like a waterfall. Boom, estrogen levels drop massively. You go into a total different hormonal milieu, and as a result of that, for whatever reason, it changes the entire shape and foundation of the facial fascia. So what happens is the facial fascia is like a girdle. It holds your whole face up. Jawline, neck, everything is up. Then once that moment happens, starts to slip and slide. And then the jawline, the mid-face, the eyes, everything just starts to, basically, and it probably has some correlation to do with collagen. Who knows? No one really has a specific understanding of what that relationship is when it comes to this aspect. I mean, the skin, as I mentioned, has to do with collagen. What's happening at the fascia level, not clear, but we know that that's where it happens. So that result happens in the corners of the brow coming down, the mid-face encroaching towards the mouth, jawline starts to form jowls, neck starts to sag. You lose volume throughout the face, areas like the temple, above the eyes, below the eyes, down around here, the lips, all that starts to change shape. That's where you start to become looking like a different person, right? So that's what the 50s, why that's such an important milestone, is that menopause changes that and changes everything very abruptly. So logically, the tools that might have helped somebody in their late 30s and early 40s when the face was firm and tight may not result in the same kind of treatment result as you get at that point. And this is really, really important to understand, and really, really, really important to think logically, is like you don't have the same diagnosis after 50 as you did when you were in the 30s. 30-year-old, typically speaking, doesn't have any sagging, right? But there's a lot of 30-year-olds, and you may be one of them who started at this age, or maybe one of them that are watching this right now, who do some Botox, who put a little bit of filler here and there, and love the treatment outcome. You love it. I mean, Botox around the eyes feels good, looks good. Early 40s, same thing. A little bit of volume here and there, love it. Makes a big impact, you feel great. Why? Because you're losing some volume in your 30s and early 40s, but you haven't started sagging yet. The differentiation is sagging. When sagging happens, the algorithm fundamentally changes. And what's fascinating about this is, chances are, even your own doctor, your own injector, your own dermatologist, and many plastic surgeons don't completely understand this aspect. Frankly, for years, decades, I didn't understand this. I treated my 50-plus-year-olds who didn't want surgery the same way I treated my 40 or 30-year-olds, like putting filler here, putting filler there, doing this, doing that. It didn't take that long for me to start to realize that, every time I inject this person, it not only doesn't seem to have the same effect, but it's almost like making it a little bit worse, a little bit worse, a little bit worse. And then, if you're astute and you're watching your results, which every one of us who are in this game and practice should be doing, paying close attention to cause and effect, you start to make the connection. You start to understand that, hey, there's something off here. And I'm gonna share with you why those things are off. All right, so here we go. All right, so in the category of mistakes, let's start with Botox. All right, so I alluded to this, but I'm gonna talk specifically. Botox is commonly used to decrease the movement of fine lines and wrinkles around the eyes. So when you put a little bit here in the glabella muscles, what you see is it reduces the 11s, these two muscles that kind of pull in like this, put it around the crow's feet, decreases the orbicularis muscle from contracting, therefore you're getting less lines and wrinkles here. You put it in a forehead muscle, the frontalis. You see that the lines are in the forehead soften. So overall you look a little softer, more youthful, and has a beautiful, very, very gorgeous effect. But remember, as I said, post 50, things are changing. So if you're somebody who used Botox in your 30s and 40s and then continue to use it in your 50s, you're noticing something different is happening. Number one, if you're used to using it in your forehead, right, the muscle, frontalis muscle. Now remember, the frontalis muscle is the muscle that pulls your eyebrows up. What is happening during aging? The aging process is dropping the brow. The corners of the brow start to drop, you get hooding around this area. So this is all coming down. You're also getting increased eyelid skin, process called dermatochalasis. You're getting increased skin on your upper eyelids. So you begin to actually require your frontalis muscle to lift. You're requiring your frontalis muscle to elevate the corners of the brows, to open up the eyes a little bit, because when they are left down, they feel heavy. Subconsciously, there's a reflex that makes this area feel heavy, so you want to do this. You walk around like this. What happens when you put Botox in the frontalis muscle? The net effect is the muscle relaxes. I mean, Botox takes the oomph out of the muscle, takes the strength out of the muscle. I don't want to use the term paralyzes it, but that's basically what it's doing. It's making it ineffective. So naturally, what happens when you put Botox here, the brow can't lift anymore. The only muscle that lifts your brow is now inactive. So what happens is this extra skin that you had on your lid, the corners of the brow that's coming out, all of a sudden it's going to feel heavier. And you're like, wait a minute, I've always put 10 units in my forehead. Why is 10 units making me look heavier and more tired looking now? Well, there's the reason. Because what is happening is you need this muscle to work. So mistake is to use same doses or high doses of Botox in the forehead as you age. Post 50, you need to reduce the amount of Botox that's used in your forehead. Higher up on the forehead, so it's not as close to the brow as possible as one other workaround, but also just overall less. So, I mean, back in the days when I was doing Botox, I would start putting in if I did nearly a decade and a half of 10 units, I started putting 6 units in, and then eventually 4 units, and then eventually no units, because I wanted this brow to move. Another area, crow's feet. Crow's feet is this, treats the orbicularis, right? The orbicularis muscle is the one that wraps around the eye. And you squint, it contracts, creates these little lines. Now, if you have puffiness under your eyes or excess skin, which is part of aging, post 50-year-old aging almost ubiquitously is going to cause excess skin and in some cases some puffiness under the eyes. Well, if you take the tone out of the orbicularis muscle, which is contracting, what happens? The bag comes forward, right? It looks bigger. The excess skin doesn't have contraction, so it kind of droops down. I've pissed off a number of patients. I've literally ruined like vacations over this, where back again, when I was earlier in my practice, I inject Botox, normal routine. It's like, oh, no big deal. Come in and inject Botox. You got some lines around here. Inject it, boom. Endless calls. What did you do? My eyes look worse. My bags look worse. That looks worse. I'm like, oh my God, what happened? What did I do? I just injected, 8 units of Botox in around the eye. Why is there bags on? There's no way that can happen. And you see the person, you're like, okay, yeah, I see what happened. And then you start to put 2 and 2 together and you understand that this muscle is actually needed to kind of contract and hold that skin up. So when you're younger, or if you don't have any loose skin yet, yeah, you can treat this area judiciously. But as you get older and that skin and puffiness become greater, you need to back off on the amount of Botox that's used in that area, or else you're gonna end up finding this eyelid issue to get worse. This area, the glabella area, no real issue. You can treat it at any age or at any point. These 2 areas are mistake areas that can actually make you look older and worsen this situation. So be aware of that. And if you are an injector, especially if you're new and you're watching this, you're welcome. You're gonna save yourself from making the same mistakes I have made. The expression is necessary for certain types of situations, and it compensates as you get older, all right? So keep that in mind. So let's talk about filler, mistake category number 2. So fillers, when you're younger, in your 30s, it's kind of like where, mid-30s and beyond, you start to lose enough volume in your face to where you start to look a little gaunt, a little tired, this and that's happening, right? So a little bit of filler in the temples, a little bit of filler under your eyes, a little bit of filler in your lip, whatever, it's really pretty. It can have a gorgeous effect. I mean, you can see why people come back for more and more, because it has a very meaningful effect. Even sometimes a little bit of augmentation in the cheek can look really pretty in a 30-something-year-old, aesthetically speaking. If somebody has like a flat mid-face or doesn't have strong cheekbones, adding a little bit can have an aesthetic effect. All good, right? Person ends up enjoying it, loving it. 6 months go by, I want a little bit more. Of course, fillers are supposed to leave by 6 months, which we know is not true. Fillers don't completely go away. I've done videos on this, so check them out. So you come in 6 months, come in a year, a little bit more, a little bit more, a little bit more. Now, onset of aging kicks in, right? Mid 40s and beyond, aging is creating sagging, right? Now you're in your late 40s and 50s, and you're used to this process of getting a little bit of filler here and there. But guess what's happening? So as the mid-face comes down, you start to see a trough here. This kind of like flattening and hollowing of this mid-facial area. And it's natural to think that that is related to volume loss. And it's natural to think that what you need is more filler placed into the cheek. I mean, maybe you haven't even had any filler placed in your cheek before that. Maybe you were just going in for lip augmentations and a little bit in your temples, a little bit under your eyes, whatever. But now, since you're after 50, the cheek is coming down. Well, guess what? As the cheeks come down, the jowls start to come down. You start to get heaviness here. Neck starts to come down, etc. You reach for filler. You go into your dermatology, plastic surgery, medical spa office, and you say, hey, what do you do for this? And they say, oh, let's get some Voluma in there. Let's get some Radius in there. Let's get some this or that in there. Boom, little filler here. Oh, what you need is a little bit of filler along your jawline. Let's put a little bit of, because you got a jowl here. This is like an area that's like puffing out. So you need a little bit of filler in front of it, a little bit of filler behind it to smooth out your jawline. It's gonna look great, you're gonna love it. Boom, off you go. Get a little bit in there, oh yeah, it looks a little bit better. A year or two goes by, now it's like jowls are worse, naturally, because you're aging, it's a progression. Oh, as your jowls are coming down, oh, you need more filler on your cheekbone to lift this area up. So more filler goes here, more filler goes here, more filler goes here, more filler goes here. This is like your standard, I'm gonna lift your face back up and so you don't have to, have surgery, et cetera, type of an approach. Guess what ends up happening? You just start looking like big and round. The jowls aren't going anywhere. You're not putting enough in here to lift it, and if you did, you'd look like an Avatar alien or some very unusual thing, maybe a basketball even if you put enough. But the bottom line is your face starts to get huge, and your jawline starts to look like a linebacker. It doesn't look like a delicate, jawline anymore. It doesn't look like a V shape, which is what it did look like when you're younger and before it started to sag. It just looks blockish. And more filler here and more filler here, literally all it does is make your jawline look more square. Whereas when you're younger, this was elevated, the jawline had a V to it. Now it's like a square shape. This is how I learned this lesson. I've had patients, 15 plus years coming to me for various treatments from their 30s on up. And when they got to that age, I was like, God, this is just not looking right. And to be honest with you, like I said, I'm pretty astute with my own, mistakes. So I don't like to make mistakes for too long. What I started to notice was that the filler that I used to put into a face and made a big improvement hardly had any improvement anymore. Really just didn't look like anything happened. It felt wasteful. It felt like I'm just like charging this person all this money to put fillers in and they're not coming out looking that much younger. I didn't get into this whole like year after year of doing this. I kind of just lost interest and lost hope in that particular tool for that particular patient. So I just said, no, we're done. We do them in our office, but we do them with the same philosophy I'm sharing with you, that if you're over the age of 50, there's really no point in doing fillers to lift the face, et cetera. Small amounts here and there can soften certain features, they're fine. But if you're trying to really establish a youthful look by using fillers in some significant amount in the areas that I shared with you, you're gonna worsen your situation. You're going to end up looking worse as a result of it. Heavier, rounder, bigger, less delicate, less feminine, all the stuff that you're not doing this for. You're doing this so you can look like yourself, like you did when you were younger. You're not gonna achieve that with a filler. And those are the reasons why. And to cap that point, I won't even do a fat transfer on a patient who's basically 45 and above, because they have some element of laxity. And when you have some laxity, fat transfer, filler, doesn't matter, isn't going to help the situation. It's not gonna be effective. So just know that volume by itself in that stage of life is not gonna help you. It's going to potentially hurt you. So mistake category number 3 is energy devices. And I've done lots of videos on energy device. I'm gonna review it here with you. So what is an energy device? So energy device is this bright idea, this concept that if you apply energy to the fascia of the face, energy being heat, being ultrasound, being whatever, radio frequency, what it's gonna do is it's gonna cause the tissue to contract, right? I mean, it does do that. You put a little bit of heat on a piece of fascia, you see the fascia in front of you just shrinking up. The idea makes sense. I mean, you cook meat, you see what happens to meat, it just shrinks up, right? That's not a false concept. The problem is, however, if you're trying to reach the fascia of the face, which is, maybe 4 to 6 millimeters below the skin, and you're applying energy through the skin, so it goes through the skin. What's below the skin? It's a layer of fat called the subcutaneous fat layer. So now it goes to skin, then you go to the fat, and then underneath that is fascia. You're going through a lot of important structure before you even possibly get deep enough to get to the fascia layer. If you get to the fascia layer, put a little bit of heat on it, okay, so it contracts a little bit. One of the things that happens when you put heat on something, yeah, it contracts, but a lot of times it just kind of opens up again. Beautiful idea, brilliant, engineering concept, and really has become like the forefront of the last 20 years in terms of innovation and hope to eliminate the need to do surgery, is these ideas of energy devices and all different types of energy, as I mentioned. But suddenly we started hearing more and more, and I did a whole video on procedures that age you, started hearing more and more that people that use these devices are coming back and saying, oh my God, I look worse, I look older. Not only do I not look tighter or better, I actually look like I've aged. And I'm not kidding you, there's probably at least 2 or 3 consults I talk to each week that are describing this. Early on, I thought these these folks must be like smoking something. There's no chance that, they go in for a treatment like this and they come out looking worse. But it took a while for me to hear it over and over again, to start saying, hey, maybe there's got to be something to this. These are independent, sources. I mean, none of these people are related to each other, and they're just complaining that they come out looking more gaunt and more tired, more hollow, and more this or that and the other thing. Maybe there's some truth to it. Then you start looking at exactly what's going on. We never owned one of these energy devices in our practice, so, not guilty of charge of this one. But you start thinking, and then you're like, okay, that's what's happening. So now I understand, and I think there's growing consensus on the notion that applying energy through the skin and the fat is not a good idea, because fat melts just like butter does, and skin doesn't even like to get that kind of energy placed through its entire surface. And I mean, when you do a laser, when you do other treatment, you're treating the top layer of the skin. You're not putting energy through the entire surface of the skin. That's not a good thing. Skin doesn't like that type of energy. It's not good for the skin. It's not good for the fat. And at the end, it doesn't do anything for fascia. Show me somebody who's 50 years and above, who's had a meaningful change with an energy device. You're gonna have to search long and hard. There are not that many of them out there, because it just doesn't work. So you're taking all this risk. If you plan on going really deep and going even deeper than that, well, right below the fascia, there's facial nerve. So no one wants to go that deep. And people who've done these things and gone really deep, they've found themselves regretful, not just the person, but also the practitioner, because they're like, shoot, there's nothing worse than telling a person, sorry, I hit your facial nerve with my energy device, and you also don't look any younger either. That's a really hard, so there's usually not an overly aggressive in terms of like hitting those type of problems, because I think anyone who's smart enough wants to avoid them, but that also means that they're just shallow of the actual fascia and just right in the fat. So it's like you're placing it in the most pointless part of the facial anatomy. So as a category, more risk, more potential harm. They're not cheap. They don't do anything. So if you're above the age of 50, don't go that way. Times when you hear people loving it or raising their hand saying, oh, I gotta go, you ask them how old they are, they're usually like in their 30s and early 40s, and they barely have anything going on, and it's like, yeah, maybe there's some imagination going on there that they actually look tighter or better, or maybe it's temporary, who knows? But I can't tell you how many spa owners, injectors, nurses, dermatologists, etc., that have these devices in their own practices have come to me after years of doing them on themselves and shared exactly this fundamental story. And I'm not throwing anyone under the bus as a group or category, but the bottom line is, yeah, maybe they work well for 30 and 40 years, because there are some laxity that happens in those ages. Maybe they're fine for those, but there's also the caveat of potentially causing some worsening. So choose carefully, but if you're over the age of 50, don't even look at this. Category number 4, threads. Threads are a very, talk about one of the greatest wastes of time, money, and energy in the facial rejuvenation, spectrum. It's been around, 20 plus years. And when I was in my fellowship, they came out like gangbusters, this company called Contour Threads. Sure enough, after 2 years of everyone trying it, etc., they went bankrupt because it was like, this thing is completely worthless. It's painful. It doesn't work. It doesn't make any sense. You're gonna put a barbed thread through the skin and try to tighten it up. Well, what's gonna happen to that extra skin? What's gonna happen? Well, the studies show that, and I've shared this with you guys before in previous videos, that it lasts typically between 3 to 6 months at best, usually not a significant improvement, and there's complications associated with it. Infection, risk, dimpling, protrusion, etc., etc., etc. So if you're over the age of 50, this is not your treatment. Just not your treatment. It's not gonna do anything. It's not gonna do squat. Category number 5. Everything I've shared with you so far has been non-surgical. I'm talking about some surgical mistakes here. On a global level, you've got different parts of your face that are aging simultaneously. As you know, I've talked about before, on one hand, you've got skin, the other hand, you have volume, on the third arm, you can't even say that. Third vertical, you have sagging. What are things that sag? Upper lids, lower lids, corner of the brow, mid-face, jawline, neck, and the top lip gets longer. So these are the things that sag. Volume is facial fat in specific areas that begin to lose, and the skin, fine lines, wrinkles, loss of collagen, pigmentation, etc. Those are all the things that come together to make a face look young or old. Now, why is that important to note that? Why is that important to accept that as a reality? Because a lot of times you'll go in, you as a patient will go in and want to treat the thing that bothers you the most. You're above the age of 50 and maybe it's your neck and you say, hey, I want a neck lift. So you go in and get a neck lift. Surgeon goes in, makes a cut here, brings the neck muscle together, makes a cut back here, tries to remove a little bit of skin. Cool, looks a little bit better, or looks a lot better. Well, guess what? A year goes by, 2 years go by. As the jawline comes down, the neck starts to sag more. It's like, I didn't get any durability out of that. Not to mention the fact that in the moment, you've got a tight looking neck, but you've got sagging jowls. It looks kind of weird. Here's the reason. Anatomically, and again, I've done a video on this very topic, but the concept is the platysma muscle attaches to the clavicle, goes all the way up to the face. It attaches here, all part of the SMAS of the face, which is the fascia layer. What happens is the face starts to come down, as I mentioned. Well, what's holding the neck up? Nothing. The neck starts to sag because the face is sagging. So without lifting the neck, I mean, you can just do this yourself. Lift your face up like this, grab a hold here, right there, right here, pull up, and watch what happens to your neck. Your neck completely flattens out underneath. And that's because you're pulling your platysmal muscle back up to where it was originally. So fundamentally, neck lifts by themselves are not good ideas. I don't do them for people over 50 for that very reason. I do what I call my vertical restore, and you guys have seen the results from that. But basically, it's the notion of taking all of this fascia and bringing it all the way up. So the fascia of the neck, mid-face, lateral brow, jawline, all move up together. The vertical orientation takes the neck with it, takes the jawline with the mid-face with it. The point of it is, and why I do it the way I do it, and why I trademarked it and developed it the way it is because in my mind, and I think there's, again, no point to argue this because this is a simple reality, all that fascia is starting to come down. You want to bring all that fascia up. If you start piecemealing the neck, start piecemealing like, oh, I'm just going to go get a lower facelift and just tighten up, kind of pull my jaw sideways, and your neck is still age looking, your mid face is still down, the corner of your brow is down, and you just tighten up this. You know what you're doing in every one of these moments? You are messing with the balance of the aging process, and you're leaving your face looking weird. Right? How many times have you walked into a room and you're like, oh, immediately that person's had work done, that person's had work done. Why do you say that? It's not because you know anything about them. It's because they look weird, they look different. Major reason why you look different is technique, obviously. Surgeons, I guess, call it talent or ability, but also the combination of the procedures that are done. And this is something that's not discussed enough. Because when you're younger, either you look all the way young, every aspect of your face, from your skin, your volume, corners of your brow, mid-face, jawline, neck, everything is like young looking. And when you're older, guess what? They all start to become older looking. And that looks normal. It just looks like a normal older person, which is fine. What doesn't look fine is when all of a sudden you have parts of your face that are young and parts of your face that are old, and that looks really weird. That is a fundamental issue which speaks to the concept of not treating your face in a comprehensive way. For example, getting a facelift done and not doing your eyes. Getting a facelift done and not adding volume back into the specific areas. Or vice versa, doing fat transfer for the reasons I've just mentioned earlier, or doing your eyelids and not doing your jawline and neck. So now you have 20-year-old looking eyelids and you have a jawline of a 56-year-old. Doesn't make sense, doesn't exist in nature that way. So the bottom line is, piecemeal approach to facial rejuvenation surgery is a bad idea. It doesn't result in the natural, comprehensive, harmonious rejuvenation that you expect and want to see as a result of surgery. So a lot of surgeons will do this for you. They'll do these parts alone. I won't. I've been like that literally from the very, very beginning of my practice, and become even more, sort of adherent to these principles because I am known for. I'm literally, my MO is I create big rejuvenation, but people look 100% natural. So when the average patient comes to me and they're above the age of 50, you can see this in all of our before and afters if you go through our website or Instagram, watch the videos, etc. You'll see that the average person who comes to me ends up getting, usually as a foundation, gets a vertical restore, which is the treatment of the lateral brow, mid-face, jawline, and neck in a deep plane fashion, bringing all this back up. So that all gets handled in totality. I do a fat transfer in 99.9% of the cases, add volume back in those important areas. I take care of the upper and lower eyelid skin, again in probably 90-something% of the cases together. So those four things, upper lids, lower lids, fat transfer, and vertical restore is, like, generally speaking, the most basic facial rejuvenation combination for 50-plus-year-olds. Then maybe 50-60% of the people have an elongation of the upper lip. We'll do little lip lift to shorten that distance to bring harmony and balance, because this gets longer, it looks a little different, it looks a little out of balance. So that all gets done. And then on 100% of our patients, we treat their skin so that their skin can look beautiful. If they need a laser, we'll do a laser. But before and after surgery, almost all of my surgical patients are on the trifecta, which is the skincare I developed that is really a treatment. I mean, at the end of the day, it's like a 3-step treatment type of a skincare protocol that you do twice a day. And then month after month, your skin gets better and better and better, more youthful. So when the whole thing comes together, shape, skin, you have a beautiful rejuvenation. So the 5th mistake is piecemealing your facial rejuvenation surgical approaches. We talked about 5 major mistakes. We talked about why those mistakes can affect, the face in a negative way. At the end of the day, the proof is in the pudding. I've shared with you the right way to treat it. And for people who are over 50, and I want to make this very clear, if you're over the age of 50, surgery is going to be your only real solution. Like it or not, if you're like, oh my God, he's a surgeon, he's telling me this because he's a surgeon, which is, I get comments like that all the time, which surprises me because as a surgeon, I can literally do all the things that I just mentioned, and more fundamentally, I don't even have to do them. I have my nurses or nurse practitioners do them all day long while I operate. So I mean, I could leverage my license in an incredible economic benefit for myself. But my thesis and my approach has always been, I'm really treating this entire specialty like it's a medical specialty. I mean, you don't hopefully go to a heart surgeon, a cardiologist, and have a blockage and be told you need something that isn't going to actually treat the blockage, right? You're going to be told you need a bypass or you need a stent or whatever it is. There's a certain level of ethics that should override our specialty, and it shouldn't be necessarily driven by like what drug reps say and what financially makes the most sense, etc. At the end of the day, a particular diagnosis requires a certain treatment. And the aging face post-50, the diagnosis is the things that I just mentioned: laxity, volume loss, and that requires a surgical approach. Surgical approach addresses everything together, and then off you go. And you're good to go for a long time if you do the right type of procedure. And again, I should also mention there's a variation between surgeons and how they do certain things and techniques and all that kind of stuff. So do your homework, and I've done videos on this as well. Do your homework, make sure you're in the right hands, do it right, because it sucks to have to do it again and not be happy with the outcome as well. But assuming you're gonna do your homework and do your research and find the right surgeon for yourself and do it the right way, you'll be very happy with the outcome. God willing, you'll be very happy with it. And then you won't need all these other things at all. You'll be kind of free. You'll be like the kind of freedom you had when you were in your 30s, where you weren't even paying attention to, what's happening. And this is, I think, the most important thing that our patients achieve is the liberation from the constant, what's next? What do I do? When do I go in? Make another appointment, this, that, the other thing, etc. You're done with all that. So in our practice, that's how we approach it. I'm open to challenge. I'm open to hearing what you have to say. But the proof, my friends, are in the pudding. These are the before and afters. You see what a substantial change happens when this principle is applied to these patients. They look normal, they look natural, they look balanced, they look significantly rejuvenated, and ultimately, you ask every one of them, they look as young as they feel. And that's really what it's about. All right, folks, I hope you enjoyed this video. I hope it helps you. Please share it with some friends and family. Let's get the word out. If you haven't already, make sure you subscribe to the channel. Make sure you follow along. We're gonna have lots of great, insightful videos, as well as the CarumMD Journal, which is a newsletter that comes to your inbox. So make sure you subscribe for that so you can get even more knowledge and information about topics mostly related to skin. And if you enjoyed it, hit like, add some of your comments below. And until next time, Dr. Amir Karam.